The Rural Women's Health Project has developed a unique method of communal storytelling, and that's really the basis of the fotonovela. It really blends together different aspects of non-formal education, sociology, and health education, and our goal is really to create a vehicle for community action so that the novellas move people to do something. And this allows us to really put the focus on raising the community's health awareness. Fotonovelas are similar to graphic stories. The difference is that instead of using a drawing, we use a photograph. Then we use voice bubbles and voice boxes in order to communicate the message. Fotonovelas are based on a tool that was started in Africa and has been used all over the world. But fotonovelas really found a home in Latin America, especially in Mexico. They were kind of the cheap dime store novel equivalent. Very little text, very visual.
The fotonovela is uniquely different from those found in Mexico. Just as the target community of Mexican farm workers and Mexican Americans changes when they cross the border and begin the acculturation process, so do the RWHP novellas.
So the fotonovela allows us to teach contemporary concepts, access to services, but it's all done within the reality of the culture. Our fotonovelas have covered such topics as domestic violence,
HIV/AIDS,
drug abuse,
anti-tobacco,
alcohol abuse,
cancer,
diabetes.
sex education.
Farmworker Justice and Rural Women's Health Project have been working together for well over 5 years in developing fotonovelas and innovative training.
I think El Paso is interesting because it brought together women that had never worked together to create an awareness within their community about HIV.
The HIV incidence in the Latino community is about 18%, even though Latinos only make up 13% of the United States. And this is based on the 2007 incidence data done by the CDC.
Everybody has seen a different face of the epidemic, and they were all anxious to find a way to create messages that would prevent the experiences that they've had, or be more efficient in supporting the education work that these groups were carrying out.
The idea was that these fotonovelas could also be used by other communities throughout the United States.
Once we finalize what the health issue that is of concern to the community, we look at it in relationship to their culture, their religious beliefs, what's accessible in the community, and what's really possible for them to accomplish within the confines of their community.
Even throughout the whole workshop, we worked closely with the women on helping them write the stories. We wrote the stories in Spanish and English and helping them construct the stories and taking their ideas and putting it more into a comic book style.
I think fotonovelas are a way of reaching people in part because you see people who look like you, who sound like you, who have your experiences, and you're following a story. And I think that story allows you to relate to the message that the fotonovela is trying to impart.
Just the process of seeing these women create their own stories that may or may not have reflected their lives or their experiences was really fulfilling.
The development of the story has been very exciting because it's the community's words. We act simply as facilitators.
In the end, we leave the fotonovela as a community tool to make change.